Yeah, I can't lie, these do slap. Listen, I don't care how cold it is, you still need to hydrate. Same way, especially if you've got sickle cell, please keep hydrated. But whilst that is settling, I want to talk about people with sickle cell being more prone to infection. When you have sickle cell, it can be a possibility that the spleen doesn't work properly. Now, let me get up some notes for this because I ain't trying to miss nothing out, and there is quite a bit to cover in this topic in particular. So the spleen is tasked with filtering out old blood, debris, and pathogens. So when your spleen isn't functioning or working in the way that it should, that can make people with sickle cell more susceptible to infection. So the most common infection-related mortality and morbidity is linked to invasive pneumococcal disease. So pneumococcal disease is actually caused by bacteria that is linked to infections or illnesses like pneumonia, sepsis, and meningitis. For me, my hematologist recommends that I take the pneumococcal vaccine every 5 years. The reason behind taking the pneumococcal vaccine is so that the illnesses that I mentioned are prevented. By the way, I'm not now telling you that, yeah, you need to go and get the pneumococcal vaccine, or yeah, I'm encouraging it, blah, blah, blah. No. If you want to find out about the pneumococcal vaccine, please consult your hematologist. I am not a healthcare professional. I have to keep reiterating that because I don't want anyone to think I'm giving out medical advice. I am not. People with sickle cell tend to, from birth, go on penicillin prophylaxis, which I'm not talking much about that because you're going to have to wait for P on the A to Z for sickle cell series. But basically, penicillin prophylaxis is a very common form of treatment to avoid risk of getting the illnesses that I mentioned. I don't think I've got spleen dysfunction, but I'm still on penicillin daily, twice a day. When you do have sickle cell, you are at the risk of being more susceptible to infections, especially if your spleen is not functioning in the way that it should.